05, but right now it's Dr. Guy Giesecke, CEO of Children's of Mississippi and Weiser Hospital for Women, and Dr. Mary Taylor, Chair of Pediatrics at Children's of Mississippi. Dr. Giesecke, Dr. Taylor, thanks for coming in.
Thank you.
Thank you.
You guys got a lot going on at the Children's Hospital. Give us a quick overview of that. It's very impressive.
Well, I'll get started, and so some of the construction projects and actually new services that we're starting is we have Alice G. Clark Center for Medically Fragile Children that's under construction that ends towards the end of this year around November, and that's going to be the first facility in the state that's going to house all of some of these complex patients that really don't need acute care, but they also don't have the resources or the ability to go home, so they need like long-term care for children. This is the first facility like that in the state.
Okay.
So that's one thing. We're also building an adolescent psych unit, and so that's going to be the first medically based adolescent psych unit in the state as well. So we have a child psych unit, but we don't really have a place for adolescents. So that's a new service for us. We're also building a playground so that the child and adolescent psych patients can actually have a place to go and run around and get some of that, use some of that energy in a productive way. So that's another construction project, and we're doing a renovation project too. I'll let Mary talk about that.
Yeah, we're renovating the Batson Tower, which everyone's probably familiar with. It's the initial children's hospital that was completed in 1998, and it sorely needs renovation. And we're redoing all of the nursing units and the patient rooms on each floor, kind of floor by floor, in order to make it look and feel like the Sanderson Hospital, which is our newly constructed areas.
So some of the information you guys provided, I was impressed, Dr. Taylor, with this point. 220 pediatricians and pediatric specialists in 30-plus medical subspecialties.
Yes.
For Mississippi's children.
We have many. We are actually one of the largest departments at UMMC. We have quite a few, I guess probably around 180 of those are in the Department of Pediatrics, and some of them are surgical subspecialists that just take care of children. So pretty much anything you can think of that an adult specialist might have or see, we have for children, including all of the surgical areas like neurosurgery or orthopedics, all of those things. We have multiple specialties, about 20 some odd specialties for children, and we have recruited people from all over the world really to take that kind of care of children.
Wow. Dr. Giesecke, is this something that's been planned for quite some time and is just now becoming a reality due to everything involved in pulling something like this off?
Yeah, so we when we were planning the new construction, so the Sanderson Tower, and so that was finished in November of 2020, and that was about a 5-year project leading up to that. So we knew that there were some components that we couldn't afford at the time, or we couldn't logistically do, and so that's why when we started renovating those inpatient floors that are still in the Batson Tower, we knew we needed to raise money for those, and so this was always planned, even going back 7-8 years ago, that would be done, as well as the adolescent psych place. And we also finished a cancer center about a year and a half ago. We renovated our cancer center. That was also in the plans, and actually Dr. Taylor started the fundraising for that when we were actually building finishing construction on the Sanderson Tower.
So, Dr. Taylor, of course, remarkable work done there at Children's and Larry Batson's and so forth. Are we serving just Mississippi children, or do we receive some that are perhaps referred from other states?
We see a few patients from surrounding states. Primarily, it's the state of Mississippi. We always love to encourage people to know that we cover the entire state of Mississippi, not just the central Mississippi area. Although our children's hospital is right here, we can drive right by it. We have outreach locations throughout the state. So we have subspecialty clinics in North Mississippi, on the coast, in Macomb, Meridian, Hattiesburg, really throughout the state, including Greenwood, Greenville. And we want to serve all the patients. We want to improve access so children can come from wherever they are. They can come here to get service that is a higher level of care, but they can see some specialists in their hometown.
So are you primarily sort of filling a void, perhaps, providing services that maybe the outlying clinics and hospitals cannot?
That's right. So, there are pediatricians throughout the state, but we want to serve those pediatricians to provide that subspecialty care. So if they need to see a cardiologist or a neurologist, they can see them hopefully close to where they live, and if not, certainly at the Children's Hospital.
Yeah. Remarkable. What did we do, Dr. Giesecke, before we had all this?
So, yeah, it was. I think mostly we covered the middle part of the state, and then Dr. Taylor and I have been here between 14 and 15 years, so we've came about the same time. But really, we didn't have all the specialties represented, so a lot of kids had to leave the state. Thinking about like 15, 20 years ago, like for heart surgery as an example. We didn't have a congenital heart surgical program, so kids had to leave the state for that care. And then you saw on the outsides, the distal ends of the state, the coast and up by Tupelo and things like that, where kids would just go to other children's hospitals. And so we developed an outreach network. Part of that was, the main reason for that was to get care closer to home, like Dr. Taylor had mentioned. But the other aspect of that is it's a business model. We can't really have a heart program, like I mentioned, or a pediatric neurosurgery or an epilepsy program, cancer services, without really having enough patients to support all of those specialists that Dr. Taylor has recruited. So we've really had to support and get referrals from the whole state to support all of those things so that kids don't have to leave the state. So it's really serving two purposes.
How difficult a task is it, Dr. Taylor, to recruit some of these specialists, which I'm sure are in high demand across the country?
Right. Many of them are in very high demand, and there are some of the specialties that we're really just grossly under represented throughout the country. But I've found that if we get someone to come here and visit just one time, we can show them the mission and why we're here and really encourage them to be part of something that really is a phenomenal opportunity to serve an entire state of people that wouldn't have that care if they weren't there. So people are really drawn to that, drawn to the mission, and drawn to be able to serve other people in that way. So it's challenging, but I think once we get people to come here once, they see what a nice place it is, great food, great people, and they really want to join us.
I've had the privilege of receiving a personal guided tour from Dr. Keaton of the entire complex, the entire campus. I mean, places that he can go that everybody can, of course. But most impressive was the NICU.
Yeah.
So how do you guys, if at all, integrate with the NICU?
So the NICU is a big part of our hospital. It's the largest division within the Department of Pediatrics. There's 2 floors in the Sanderson Hospital. When we built that, we really made a dramatic change, kind of huge change in the way NICU patients are taken care of. In the past, they were in one huge room, and it was kind of patient to patient to patient, no privacy for families. Now we have individual patient rooms. There's a shower in every room. There are services on the floor for washing their clothes, or a little kitchenette. They can have some respite time. Every child has an individual room, and parents can be there with them. So if they're coming from North Mississippi, they can stay with their child. It's made kind of a really evolved the entire care of the NICU. We also have newborn services for brand newborns who are taken care of, and we have a NICU in the Weiser Hospital that Dr. Giesecke manages that hospital as well. But that's for our micro preemies, we say. They're very, very small and they're unstable to transport, but then they come over to our new NICU. Yeah,
gotcha. We got a break right now, but if you guys can hang around, we can continue the discussion. I know there's a lot of stuff going on there.
Sure.
Thank you.
Folks, we're coming right back. Stay with us. We're in the Element Well studio with Dr. Guy Giesecke and also Dr. Mary Taylor there from the University of Mississippi Medical Center, focusing on the Children's of Mississippi, Weiser Hospital for Women, and Dr. Taylor is the chair of pediatrics at Children of Mississippi. So, Dr. Taylor, I keep seeing reports about our population being unhealthy, and that, of course, includes our children. And I know that we don't fare so well with respect to birth and delivery and then even postpartum issues. What do we got to do to improve on this situation?
Well, it's very multifactorial, as you can imagine. There's so much that goes into it, from nutrition and medical care and people getting medical care early on. We do a lot with education of our families, working with new parents, working with other departments like the Department of Obstetrics, and work on research projects for newborns and talk about breastfeeding initiatives and things like that. We do all kinds of things in those areas to try to make a little bit of an improvement in our newborn outcomes.
Yeah. The funding for all these projects, Dr. Gies, where does that come from?
So a lot of funding does come from grants. So we do have grants and research funding that will pay for some of our abilities to do these things. But a lot of it comes from operations. So, when we think about the Children's Hospital and the women's care and all of those things, we obviously have to keep our capital and be able to raise funds so that we can continue to improve and recruit the right doctors and pay nurses appropriately and all those things. But we also want to improve the health of the population of Mississippi. So not everything is completely related to a business return on investment, because we feel like it's important to have prenatal care and breastfeeding instructions and all of those things that sometimes can help with newborn outcomes.
Well, that actually does produce a return on investment, because there's a cost associated with that, and if we could perhaps prevent a lot of those conditions and the need for that sort of stuff, we think we all benefit, and we need our people healthy and contributing to society, and that starts as a child.
You're right, and if moms are healthy, babies are going to be healthier.
Okay.
And if you look at what we see in the Children's Hospital, a lot of those babies that are born prematurely, for example, at 23, 24, 25 weeks, they can generate bills of over $1 million. And so if we can just keep them, that from happening, well, their lives are going to be, much more productive throughout their life. And then also the state benefits from, not funding that care as well.
Absolutely. The Center for Cancer and Blood Disorders was reopened in 2024. Tell us about that.
So it functionally never closed down, but it was we put it in a temporary location while we renovated the basement, the bottom level of the Batson Tower. It was actually the first part of the Batson Tower that was ever constructed. So we started there with our renovation. We have brand new facility there. There's big infusion bays that have individual areas for children to come and get their chemotherapy or get a transfusion or an infusion of a medication. They have individual areas with a television and kind of comfortable place to be. We have treatment rooms and a much more expansive, reorganized area for children with cancer. We participate in all types of cancer research through the Children's Oncology Group, and so if a child has cancer in Mississippi, they're getting the exact same care they would get anywhere in the country.
So that's a good point that brings up another question, Dr. Taylor, is what sort of collaboration exists between, because there are great children's hospitals throughout the country. That hasn't always been the case, right? We haven't always had just dedicated hospital type settings just for children. That's a phenomenon that's occurred over the last 30, 40 years.
Right, probably in the last 30 or 40 years. Some larger cities had children's hospitals. Now some cities have 4 children's hospitals in one town.
Yeah.
Dallas, Texas has, I think, 4 children's hospitals. New Orleans has 2 or 3 programs. We have the one children's hospital for our entire state, but we want that hospital to have all of the services that any hospital in this country would have. if there's something we can't provide, which there are very, very few things, we collaborate with other hospitals. So if children need a liver transplant, for example, we would collaborate with another hospital and send them there.
Sure.
If there is a cancer treatment that maybe is on a protocol that we do not have, we'll collaborate with places like St. Jude and work with them. So, we have relationships with those hospitals, and we want to compare ourselves to those hospitals, and we hold ourselves to their standards. So I think anyone in Mississippi should be able to get the same care they would get anywhere in the country.
I got you. So what's on the horizon, Dr. Giesecke?
So I think all of these construction projects, those are going to get us to a new level. Our cancer program is already there, but our long-term care facility, our adolescent psych, behavioral health expansion, our renovations of our floors. But I think the continued work that we're doing throughout the state. And continuing to grow and evolve. Like we're recruiting doctors right now that start this next year that are going to expand our programs in the other parts of the state. So I think that's another thing, building up what we have. So if people really need those tertiary, quaternary services, that they're going to get even better care in Jackson, but also making sure that we provide better care, specialty care throughout the state. So all of those things are continuing to expand at the same time and in parallel paths.
I refer back to my tour. The one thing that impressed me so much, Dr. Taylor, is dealing with sick children is especially hard. I mean, that's kind of an anomaly. You don't think about children being sick. We think about as we get older,
Right.
we tend to need more medical treatment care. But it's a huge stress burden on the entire family. And, of course, you've got a child that could be suffering. But the thing that I noticed is the staff, their positive attitude about this.
Yes, that's right.
And just a spring in their step. How do they do it?
Well, I think the mission, why we're here, is just critical. Every person who works there, we take a lot of pride in hiring people that want to take care of children as if it's their child or their grandchild or their niece or nephew. We really put an emphasis on that and people providing care that they would want to have. And I think, people love being part of taking care of a child and helping them get to their full potential and helping the families get through probably their worst circumstance they've ever been in. I think while it's not a pleasant job, sometimes it's a very, very rewarding situation to work with patients and families and help them through that.
Yeah, it's absolutely got to be. But I just want you to know I observed that, and you got to be wired a certain way to deal with that. Know what you're coming into every single
That's
day.
true.
You're dealing with sick kids, and that's just a hard situation to, I guess, manage. And you got to have a certain kind of mindset to deal with that. Dr. Gies, what about any integration with the Department of Health? Dr. Dan Edney's been on the program many times. He's just passionate about the health of Mississippians more than just the care of those that are sick. Do you guys work with them in any way?
Yes, it's not a tremendous amount of direct work, but obviously a lot of things that they're involved in, we try to support. So if they're putting, in expanding mental health services throughout the state, making sure that we're seen as a referral source for that. Same thing with any kind of public health issues that are going on, making sure that our physicians are involved as expert support for those things that are related to kids, but also just the state infrastructure for health. We are for children the ultimate, where people come if there are issues. So we truly see ourselves as part of the Department of Health in terms of their scope of services.
Yeah. Dr. Taylor, is there any sort of public policy you'd like to see us adopt here in the state of Mississippi with respect to health, and specifically children's health? Mental health is a big one.
Mental health is a huge one. We have gotten support from our state to build the adolescent psych unit, which is a critical function for our adolescents in the state of Mississippi. So that will serve people aged 13 to 17, which desperately need inpatient care for mental health, and we're trying to expand those services.
Gotcha. Dr. Guy Giesecke and Dr. Mary Taylor have been our guests here on Middays in the Element Well studio. They're from the University of Mississippi Medical Center, talking about children's health and all the great things going on at UMC. Thanks for coming in.
Thank you.
Thank you. Appreciate it.
We're coming right back, folks, in the Element Well studio. Stay with us.